You're on the air.
Hey.
Hey. What's your question?
I have a herniated disc in my back, L5S1, and I always have radiating left leg pain, and there's nothing that I can do to relieve the pain. I foam roll, I have tennis balls, and everyone has told me, in order to correct that pain, I have to have surgery. So what other methods can I use to help just alleviate the pain?
Okay, are you having numbness and weakness or just pain?
No, it's just pain. It's no numbness,
Okay.
no tingliness, none of that. It's just pain, and the pain is really deep in my buttock area, so I guess that's where the disc is.
Right.
It radiates about halfway down the back of my thigh.
So like I was just demonstrating on the model, the L5S1 is the bottommost disc, and that would sit around in this area, right across here. There's the disc. Try to swing that around so you can see it. There's what the disc would look like. If it's herniated, it's pushing on the nerves here, and it could vary and press on the nerves in certain positions, but not other positions. And probably the surgery that was being recommended is a trimming of the herniated disc, maybe the cutting of the lamina, called the laminectomy here, to decompress that nerve. But if you're only having pain, sometimes injection of steroid into the epidural space right where I'm pointing, or right along this nerve where I'm pointing, can do a very good job of reducing that pain. Now,
I've had three injections in the last
it
one.
doesn't normally correct the
To be honest, it just did not work.
Yeah, it's usually a temporary solution. Other than that, we're talking about modifying your activity. Sometimes physical therapy can be helpful, but if you're having the pain running down the leg, there's not a whole lot of solutions other than trying to decompress that nerve with the surgery that was recommended.
And for the people who don't understand the terminology, there's some probably a good time to do some explanations here. If people often hear about a bulging disc and a herniated disc. A bulging disc is where the pressure is coming from the disc and putting pressure, like my hand is touching the nerve, pretending Dr. MacNichol's arm is a nerve, it could be touching it. And so if you move around, it could sometimes hit a bulging disc and give you transient symptoms. On the other hand, a herniated disc is like the toothpaste coming out of the tube, and it's permanently pushing hard against that nerve. And if that's exactly what you have, steroids may give you the temporary relief, and nothing works better than the first steroid shot, does it, ma'am? Yeah, then they typically get less effective with each one. But that does two things. One, it may give you the temporary relief you need, but it also tells you if the doctor knows exactly where the shot was given, which they all do, it tells you right where the problem is. It confirms the location of the problem so that another treatment focused on that area may be very beneficial. And if that's the case, then you need to see a pain management doctor for the type of treatments that Dr. MacNichol was talking about. And if that doesn't work, there's three absolutely wonderful spine surgeons in our area. There's Dr. Miller in Tarboro, there's Dr. Strickland, and his neurosurgeon component partner in Nash. Lindsay's amazing. You
Dr.
have
Tyler,
Lindsay Tyler. You have access to a hierarchy of care that can take wonderful care of you, but always start off with a non-surgical approach.
Right, absolutely. Okay. Well, I thank you guys so much. I appreciate your help.
You're welcome.
Thank you for calling. Bye-bye.